I want to talk about why and how some people experience such a sharp, unexpected health decline when they retire. So think about the people you know and have known throughout your life who seemed to be in fairly good health and were very active people until they retired, and then suddenly they were either a shell of themselves or maybe had a health decline very rapidly at about that point. I want to talk about the 4 reasons I most often see this happen to people. So first, I'm Dr. Michelle Fritsch. I'm a clinical pharmacist. I'm board certified in the medication use and care of people over 60. And it's through my years of being a practitioner that I've seen numerous cases like this. And as I've gotten to know those patients, I realized, oh my goodness, this was preventable. And there were 4 common scenarios that are the reason I started my business, Retirement Wellness Strategies, to get in front of this and say, how can I help people plan and anticipate what's going to happen with retirement in a way that they don't fall into these traps and they stay healthy and vibrant and relevant throughout their retirement years, something that they actually look forward to. So number 1 is plain old not taking care of themselves. There are people who are so focused on work in those final years of their primary occupation that they skip doctor visits, they ignore symptoms that they have, they don't take the time to take care of themselves, and that does catch up with them. I don't want that for you. I want to make sure that we know where your risks are prior to you actually retiring, because your best insurance is usually in that last primary occupation. So let's take advantage of that and get a really solid handle on your health for prevention purposes. Now, the second one is people that lose themselves. They are so defined by their great success and that career that they had that they don't know who they are when they retire. And that can really mess with someone's mind. I've seen people, I kind of mentioned it before, become shells of themselves. They went from being like a household name, everyone knew them, to be around them was invigorating, and now they don't want to see anybody. They feel completely forgotten by the world, sometimes very depressed, sometimes very angry. That doesn't need to happen either, because you can have a whole new purpose in retirement that's just as exciting as the one you had in your previous career, but it takes some planning. So we can work on that and prepare for that. And the next one is people that they're so busy at work that their brain is very, very engaged. They're putting out fires, solving problems all the time. If when you get to retirement, you stop all of that and you don't do things that challenge you to think and learn new skills, then it can appear that you have cognitive decline, or if you do have the risk factors and you're predisposed to Alzheimer's disease, it will show up more quickly if you're not keeping your brain healthy and engaged. So we're going to work on ways to have it be fun, things that you want to learn, but make sure that you are actively engaging your brain on a regular basis. It will keep you so much more sharp and engaged with the world. And even if you have Alzheimer's disease, it's going to push it off till much later in your life before it's something that you have to deal with. And then the next one is isolation. I've had too many cases recently where somebody's spouse either passes away or has to move into a nursing home or other facility, and that person is left alone with absolutely never dreamed of how they were going to survive this life without their spouse. And I'm not saying that there's an easy way to do that, but rather than let life events completely take us by surprise, let's do a little pre-planning so that we can navigate and survive those things with ourselves more intact and with greater health. And so all of these things are reasons to plan, and I would love to do that planning with you. My strategy in business is called Retirement Wellness Strategies. There are a number of ways we can work together, so I look forward to hearing from you.